Assembly tour of 3rd Avenue Resource and Navigation Center. It is Friday, February 3, 2023. We are scheduled from 10:30 until 11:30 a.m. and we'll go ahead and start with Assembly member and introductions to the record, and we'll just go around, and if other folks who are here would also say their names, be great. I'm Susanna France.
Randy Soul.
Other folks who are here would also say their names. Be great. I'm Susanna France.
Randy Soul.
Other folks who are here would also say their names. Be great. I'm Susanna France.
Randy Soul.
Other folks who are here would also say their names. Be great.
Myself, Molly Cornish, Catholic Social Services. Alexis Johnson, AHD.
Jody Sweet.
Pete Peterson.
David Rittenberg, Catholic Social Services.
Ariel Berg. And we're joined by a member of the press as well. Welcome. Thank you so much, Molly and Dave and Ariel, for inviting us here today. This is really exciting to have this preview of the facility, and really looking forward to the tour. With that, I will turn it over to Molly and Dave and Ariel. Thank you.
Thank you everyone for coming today. We're really excited to talk about and show off this new program that we're getting ready to open up at the end of the month. So right now you're standing in the 3rd Avenue Resource and Navigation Center. We really see this as a place of connection and a place to break down barriers for people experiencing homelessness and trying to access some of those services. And so here we're going to have a mix of basic needs and long-term services, and try to break down some of those transportation barriers, primarily that people experience when they're trying to access services. So bringing, we have about 25 partners or so.
Mr. Cross is around.
Mr. Cross is around. We have about 25 or so partners lined up that are interested in providing services in this space in some way. So if someone comes in, initially they can come in and they can take a shower, they can get their phone charged, they can get access to a computer, access to a phone, some of those basic needs services, and then maybe after you've taken your shower or you've had some of those basic needs met, and you're feeling a little bit better, you might be a little bit more receptive to having a conversation with one of our navigators, which we'll have 3 here on site, about what are some of your long-term needs. And then if someone identified some of their long-term needs, such as my food stamps got turned off and I'd like to get those, get that figured out, we have a partnership with the Food Bank of Alaska where they'll have outreach workers down here to do SNAP outreach a couple times a week. Or if someone has a mental health issue that they want to get services for, we're working with Alaska Behavioral Health to have them have a presence down here, do outreach, intakes, engagement, potentially provide services on site. Also mentioned we'll have computers, so we'll have the ability to do telemeeting as well. And so, bringing services to where people are, bring them all under one roof so people can access them a little bit better, and then also creating an environment where we can collaborate better together as service providers. Some of those things that just happen when you get people working on the same problem in the same space. So I think especially in the last couple of years where we've all gotten a little bit siloed, I'm very excited everyone's here in person today. But a lot of those water cooler conversations that happen between case manager and case manager, about how to properly fill out this application so it rises to the top, or some of those tips and tricks of the trade that someone potentially in my position, because I'm not doing applications every day, may not know. And so just getting service providers together in the same place. The other piece is going to be trust. And so, everything that we do at CSS is based around the relationships that we build with the people that we serve. And so, having those navigators and the staff here continually engaging with people. And if someone just wants to come in and take a shower or charge their phone or use a computer, that's okay. This is not day shelter. It's not a place for people to hang out. We don't have TVs. That type of thing. People need to be accessing services, but we also thought it was important to make sure that there's some of those quick hitting, short time frame, basic needs services to get people in the door. Those are all opportunities for engagement for our navigators to come and, start those conversations with people about, what their next steps of permanent security might be. So, client entrance is going to be over here, so we can sort of start in that area. You all came through the main staff entrance. So this used to be, for people who had been in Beans Cafe before, this used to be the main client entrance, and there was the big elevated desk here. This is the cafeteria. We'll go back to what once was the kitchen. Sure. Right, so we have our front lobby here. Our main client entrance is going to be through here. We have 3 secure doors that people will be coming through. This space here will always be staffed. We can buzz people at the front door, do a quick security check in this space right here. And then there's a covered walkway behind the building. To get people out of the elements as they're coming in, and then there's a potential for a little bit of outdoor space or some picnic tables, if the weather is nice. But we have secure entrance here, and then people will come out into this lobby area where you're all standing. There's going to be seating, obviously. The furniture comes today. We're very excited. They're going to back the trailer up about 2 o'clock today, and then Monday and Tuesday they'll be putting all the furniture in. And so this is where navigators and staff will be coming up and saying, what are you here for today? How can we help you? Again, if someone just wants to take a shower or access some of those quick hitting services, we have a couple of showers down the hallway. I'd encourage people to take a walk down the hallway, check out the showers. We have 3 individual showers as well, which is really exciting. A lot of people aren't quite as comfortable using the locker room style showers, so having 3 individual showers down the hall there that are all ADA accessible. Yeah.
They are. Towel floors.
Yeah.
You're gonna have washers and dryers or clothes?
We have washers and dryers.
Dave's got,
I'll wait for that.
I wanted to. Can I peek in there?
So, but if you're in a wheelchair and you're in there by yourself, you can't get back out. Because you're not gonna open that door.
right. Yeah, there needs to be a button or something, just something to think about, because I'm running my Yeah. How are people gonna get out of the bathroom? Mr. Peterson. Doors are really fast, I don't see like a button or something. Okay, cool. I haven't been down here, so I'm like,
Lockers for people to store their belongings while they're taking a shower. And then we also have client storage. In here, so if you're meeting with a provider and you don't want to carry your bags around, there's the ability to store it here.
Wow. It's a lot of storage.
Wow,
Yeah. That's what I said, Pete.
that's some serious shelving.
There's a lot of stuff.
Your house notification is one.
Yep, it's all been buttoned up, and the
So you saw down the shower, down the hallway, are there showers, with client storage down there, that if people are meeting with a provider, they don't want to carry their bags around, they're able to store their belongings there. While that engagement is happening, some of those conversations are better done in a private space, like boarding an entry assessment or something that's a little bit more sensitive. In this front area, we have an intake room here. We have an intake room right behind Molly, and then we also have another intake room here. So if some of those conversations are better done in a private space, we'll have the ability to bring someone into a space, away from other individuals to have those conversations.
So I have a couple questions, and tell me if you want to me. So the services here are What are what? Like, could you do a bullet point list of like what types of services you
Sure.
expect to have?
Sure, so we'll have phone charging, computer access, telephone access, showers. We'll have access to navigators, which is really a big piece of the service, that are going to be able to do coordinated entry assessments, resource and referral. And then we are also looking at bringing some of our BHAP funds down here to administer some of the rental relief and homelessness prevention. And then we're also going to have some funds to be able to get people IDs, birth certificates, potentially food workers cards, like some of those low cost but high impact types of things that people need. And then really the strength of the space is going to be the providers that we're bringing in. I think Ariel knows a little bit better specifically, you know, what's on that list of the 25 providers. If you just want to give a couple of examples.
Yeah, I think we're up to 29 folks who kind of confirmed partnership, confirmed interest and involvement. We're still figuring out, you know, frequency, encountering. One example offsite is we're working with the DMV for a process where we're going to be able to get folks their IDs, hopefully in a faster, more efficient, and you know, less stressful manner for everyone involved. We're working with housing partners. We're working with like United Way to provide a ready-to-rent class for folks. Those are awesome. Yeah.
The DVR, VA is going to be down here. Project access. We have a printout list that we can provide to you. After the meeting.
So is the goal mostly to bring in partners and
Yes.
not necessarily hire additional
Correct.
service
Correct.
staff? And then how will you fund your operations? I think that Molly mentioned that they're hoping to get 1Q appropriation through the alcohol tax. Is that above what we've already been appropriating or as part of the package? I'm just wondering how you're gonna.
Yeah, so that I believe was part of the package that we had put forward as a group of providers. I think there might still be a little bit of work that we need to do on that to get that forward. But the initial operations and the capital has been provided by Rasmussen and Widener. We have a little bit of runway before we need to think about how to fully fund the operations moving forward. But you know, we're definitely going to be going, looking at all different funding sources that might be available. One of those will likely be the alcohol tax, but also, you know, looking at philanthropy and some other options as well too. I don't know if you want to add. No, okay, great.
Yeah, last time for the November budget, we had partners, I think ACH and you all and others that put forward a vision that Felix worked on that was really helpful, because otherwise we have everyone wanting the whole alcohol tax and we have other things. I'm always on this soapbox, so hopefully someone else will do it once I leave. But just it's not an endless fund, even if the work is good. So hopefully we can find some ways to fund it within the existing amount.
Yeah, I guess just to add on that, I think as folks will remember when they saw the proposal from the allied providers, really what it talked about was what we can do in November and what we can do in Q1. So it's a two-phased approach. And it was all also within what we expect to spend in the alcohol tax at any given year on homelessness. So wasn't necessarily asking for an additional, it was just all within the expected budget.
Okay, and I think we did put a plan out in the budget for all the revenues we expected. So there probably aren't additional things in 1Q. It's just.
There will be, so there will be some additional configurations to the alcohol tax budget.
Existing amount of money. Okay, got it.
In 1Q.
So you're kind of, as intake, you're kind of the tip of the spear, so what do you have plans for some kind of management information system as you gather? You're gonna have the ability to gather a lot of data on homeless in our city.
Yeah, so HMIS is not very well set up for some of these quick hitting services that we're talking about, showers, storage, that type of thing. So we have our own database that we use Apricot, which is a database tool that we're building for this program. when we're doing coordinated entry assessments and that type of thing, or if we're working with a partner that already has a project in HMIS, all of that information will go into HMIS. As far as individuals, like who's coming through the door, who's taking a shower, who's charging their phone, like those types of things are going to go into our database, and with some sort of data sharing agreement, like we want to be able to, the community to be able to use that some of that data. So if someone comes up on coordinated entry and we're not able to find that individual, but we know that they come down every Tuesday to take a shower and every Friday to charge their phone, you know, we want to be working with those case managers so that people have access to that data, or if, you know, they're looking for someone to be able to use that as a resource. So we're definitely having good data for the program from the start. The HMIS tool doesn't really have what we need to support some of those, you know,
Thanks, Scott.
taking a
Steve.
shower. Yeah. I'd be interested to talk to you more about that.
Only with my assembly hat on, usually municipal funding from the alcohol tax requires an HMIS data component. So just be mindful of that if there's a request in first quarter.
So I think we could put people who access the space into HMIS, but as far as managing all of the other services that are here, I would love to be wrong about this.
Great.
But I don't know how, I haven't seen in my experience HMIS be able to support that. But we will be collecting a lot of data and putting that into either HMIS when available, or our own database as well. More questions?
Thanks. Well, first off, congratulations on this facility and the program. I know for some of us, being on the assembly and through the years talking about coordinated care and what that might look like, it's really exciting to see how it could work in our community. And so I'm curious, since this is, I think, pretty new, and I know Covenant House does some of this sort of coordinated entry or navigation services as well, but it's relatively new.
Mm-hmm.
Are you all engaged with communities of practice, or do you have, are you working with folks who have been providing these kinds of services before? I guess I'm curious, like, how did you get here, or
Yeah.
you know, determine how this would function?
So we've engaged with a number of other communities that have run engagement centers. The Beacon down in Austin, Boston Healthcare from the homeless. I had the ability to go visit their navigation center. We've had calls and conversations with Minneapolis St. Paul and other organizations as well. So definitely looking at what they're doing, what has worked well, what has not worked well. The Downtown Emergency Services Center down in Seattle as well, to name another one. But also, like, what are we going to need that might be unique to Anchorage? And like one of those pieces was transportation, and especially in Winter City. So we do have a shuttle that was donated by Anchorage Neighborhood Health Center. And so we're going to have some transportation services here, which is in some of those other cities that have more robust public transportation, or don't get quite as much snow. You know, the transportation wasn't necessarily as big of a part of the program, but for Alaska and Anchorage here, especially in this part of town, making sure that as people come in to get services, they can also leave and go somewhere else, and so people are not just you know, milling around Fairview or kind of stuck here after they get services. So that's one example where we, you know, looked at some of what's going on in other communities and then identified another gap here that we wanted to fill.
So I need to ask a bit more pointed question. So as I understand it, there was a community of practice that was set up to assist with the development of the operations for this facility. So could you just tell me about how long it took for you all to go from inception to where we are today?
Oh, geez. I think we initially did the proposal
2 years ago?
Yeah, 2 years ago. 2 years. With that, there's construction time and design time and all of that. You know, it's been really like much more intense work over the last, say, year or so. But from inception to today, I'd say about 2 years. Thanks.
Another question?
Sure.
No one else does. So I think one of the things that I've always struggled with, and this is more conversation, not just directed at you, Dave, but you might have thoughts on it, with homelessness, is sort of communicate to the public what's going on, what the need is, where all the funds are going, and I think our public often feels like it's just this like money sink, we're not making any progress. I think in practice that's not true, but part of the problem has been a communications problem. And I mean, Molly and I were emailing and I said, great, you have this center, cool. How many others of these do we have in town? It's like, well, I don't really know. I mean, tell me if but it would be good to have more. And it's like, great, but always be good to have more. But how many do we need? Like, what's the goal? And how much money does that take? And how are we going to get there? And I guess if you have thoughts on that, great. And just as a general matter in this whole field, I think we struggle with communicating the needs of the community and setting goals and then talking about how we're going to get there. And I think if we could all join together and do that better, the public would be more behind us. So anyway, any thoughts you have about that?
That's a really good question, and I think that's a question for the entire community. If I were to sort of make I think right now our homelessness response system is in a lot of flux, so it's really hard to see where things are going to settle, and then how do we set that up to support that once it does settle. From what I know about Anchorage and what I know about you know, these services being in it for the last 10, 11 years or so, you know, I think somewhere around 3 would be a good number to be able to serve. And I see
3 total or 3 more?
3 total.
Okay.
Yeah, I think, you know, as long as they're geographically placed in smart locations, and I think with that, there's some other community questions that we need to answer. You know, we just brought up public transportation as someone that used to ride the bus for a long time. You know, there's some work to be done there as well. You know, there's also a pretty large housing gap. You know, we can do a lot of this work, but if there's not places for people to go, you know, then we might be spinning our wheels a little bit. So, you know, it's not just one piece, you know, but you know, I think if we're able to, knowing just sort of where people hang out, you know, one in this area, one potentially in Midtown, and then one a little bit farther to the east side, I think would go a very long way towards meeting the need. That is based on experience, not necessarily on any hard data.
You said one to the east and one where in Midtown? Did you say? Okay.
Yeah. So we're just knowing from, you know, where people hang out, where people congregate, and, you know, that type of thing. You know, I think 3 for the community would probably be a really good start.
Great.
Yeah.
Do you know what the overall budget was to totally remake this building?
Oh, I don't know the capital off the top of my head.
1.8 million.
1.8?
Chris does. And without having operated yet, but we're anticipating about somewhere in the neighborhood of 1 million for operations for
1 million a year?
Yeah, but that is without having opened the doors yet. So we'll get some actuals in a couple of months and be able to perform that a little bit. A couple other spaces to see if you guys are interested. As I mentioned, we have these and we can continue to do any questions.
Maybe you can hear us. Very cool. Okay.
We also have a space here for staff and providers to be able to drop the stuff off. Behind you, we have a program director's office and then a program manager's office. And so program director Ariel here, keeping an eye on the front, the people coming in. program manager with this really cool corner window to be able to keep an eye on the floor here. This is providers want to drop out their backpack or and then this where we started is the main engagement space. There'll be furniture and tables, some couches and tables and chairs here, where people are checking out a computer. They'll be able to use the computer here, and then this is also where we're going to have our providers tabling, doing outreach, providing information. If some of those outreach conversations, again, move to, something needs to be a little bit more private, we have these 5 private talking rooms on the outside that aren't necessarily assigned to any provider or any individual, but if we're doing an intake, or we're having a conversation that needs to move to a more private space, or a space where we have access to technology, that's going to be in all of these 5 talking rooms around the outside. Large conference room, small conference room, I'm sure you're all familiar with those. And then we'll have a small pantry here as well with coffee. Coffee is definitely mission critical for any type of program. This is not a food security site. We're not going to be doing breakfast and lunch, like that type of thing. But if we're having a conversation with someone and they can't hear themselves think over their belly grumbling, we want to be able to get them a granola bar or a sandwich or something like that. And then there's some additional bathrooms around the corner as well. Your more traditional men's room, ladies' room, I think 5 units in each. This is really kind of the heart of the building here. We really see this as a community space, so this is where we could potentially do some classes, do some other larger community meetings. There's discussion of doing some art and some other cultural enrichment projects as well. It's been really exciting to talk to different partners about, they really want to do this thing, but they don't have the space to do it. And so, really leveraging the creativity of the partners and, what their needs are. And then also, leveraging the services that are already here on campus. And so, someone earlier asked me about laundry. We won't have laundry here, but we have laundry across the parking lot. And also having a single operator on campus here as well, where we're going to be fully aligned in, rules and expectations and data and philosophy, and how we control the campus and all that is something that we're excited for.
You said they were delivering furniture, was some of that furniture donated or?
It's all part of the FFU, the building.
It would be cool to see some really beautiful murals and these big spaces.
So we're having some discussions right now about the art on the walls. We're engaged with the Alaska Native Heritage Center as well, to see what kind of how can we make this a welcoming space.
Yeah, and I don't know if you guys have worked with Steve
Oh, yeah.
program with the city and the museum did. There are a lot of different artists that have come out of that and all those murals around it.
Great idea. And then on where you came in, there's a staff work area where we're going to have a couple of workstations for our staff to use, but then also if a provider just needs some time to do email or data entry and not be out on the floor, they'll have the ability to do that. That's just going to be a room with computers and desks. As I mentioned, program manager's office, program director's office will have a break room, and then I will also be based out of this building. More questions? Molly? Everyone, anything you want to add?
Thank you guys for down your interest for resource. Dave's been doing this for over a dozen years, so he knows in and out of the area. We do a great job running the facility. If you guys have any questions, please feel free to reach out to our program. Really know the specifics of what we're doing and details about how we're functioning. Could you guys tell us what your roles are? You're in charge of the facility. Yeah, I'm in charge.
So I'm the Senior Director of Developmental Services, so I'll help Ariel to oversee this building. I also help Jennifer Store, who's our Program Director at our transit shelter, operating that program, and then also Jesse, who operates complex care, oversees the facilities. So those three programs.
And I just want to note for the record, so someone kind of brought up separation agreement, so I asked them what was the cost for that, and so it was about $180 for that.
Thank you. Questions, comments, concerns? We've been deeply engaged with the neighborhood as well. We have an open house next Friday. We have the Fairview Community Council e-board here earlier this week. We've been going around talking to our neighbors as well, just making sure that people are aware, and if anyone has questions or concerns or ideas, to make sure that they have a person that they can talk to. We're committed to a safe neighborhood, and that makes it easier for everybody in the neighborhood to live their lives and do their work, including us as well. And so, making sure that we're keeping the neighborhood impact to a minimum, something that we're absolutely committed to as well. So definitely thinking about that as we're designing the program, the operations, and the facility, and all of that.
What do you think the ideal sort of size or amount of folks that you're working with is for neighborhood compatibility? Like, did you look into that as you were talking to partners and putting this together? We've talked about sites of various.
For this type of facility, so we anticipate somewhere between 50 and 100 people a day. And that's, based on our experience running shelter across the way. I've never run an engagement center myself, and so I'm sure myself and Aaron and CSS are going to learn some things as we move forward. But considering the number of people we have on campus as well, just thinking about it not as just one program and another program, but a complete campus, like how many people can we really handle on campus over the course of the day? We settled at about that 50 to 100 number for this space. I think that number could be different depending on the type of facility or, parking is also an issue as well. So a lot of those things to take into account. But for this space, we settle on about 50 to 100 per day is what we think we're going to be able to successfully serve.
So, and you had mentioned it's not a day facility and folks will access services or take a shower. Where do you expect most of the individuals who go at the end of the day? Or, I guess thinking back, what are the hours at a certain point, to transport folks to other facilities for shelter?
So initially, we're going to be staffed here 9 to 5, but open for services from 10 to 4. We need a little bit of time in the morning, a little bit of time in the evening to sort of do our housekeeping. That was so because those are the hours that most of our partners and other providers are operating, so it's important to match those. But also, we're going to be watching that very closely over the first 90 to 180 days. And if we find there's more of a need in the morning or more of a need in the afternoon or on the weekend, being willing to adjust there. You mentioned that shuttle piece. So the goal is that we don't have 40 people discharging all at one time. That it's going to be more of someone comes in, they access services for an hour or so, and then they either get them a bed at the MS, if they're not already staying there, or engaging with some of our other shelter partners about trying to get people to cover the Sullivan Marina, Michigan.
Right, you're gonna trip on your shoe. Thank you so much.
Our navigators we see is a repository of information. So having a really good knowledge of the services that are available.
I was watching, I'm like, oh, she can't put that thing down. That's
and they need access to a shelter. That's some of the short-term needs that we want to be able to parking lot, that's something that we want to avoid. So they're just starting those conversations, like as soon as someone comes in, thinking about like, where are you gonna go when you're done? Yeah, absolutely.
So people will be able to sign up for rehab, returner, or Salvation Army, to be here. This is another navigation team, so to speak.
Yeah, so I didn't quite hear you, but I think you're talking about becoming a sign for, yeah.
Salvation Army.
Yeah, so we reached out to Salvation Army about coming down and doing outreach here. We're also working with a company called Ideal Options that does medicated assisted treatment as well. And so, you know, as part of those 29 partners that we discussed, you know, there's medical partners and substance misuse partners there as well. All right, anything else?
I do want to know for the record you're going to buy Mr. Sweet at some point. And also Mr. Cross.
Yeah,